So we're here today so that Chair Jessica Vega Peterson, Homeless Services Department Director Dan Field will be here shortly, and the Director of the Homeless Response System, Jillian Shoney, can share some important news about the budget for homeless services. We're going to hear from the three speakers, and then we'll open it up for questions for about 5 or 10 minutes. So with that, I'm going to ask Chair Jessica Vega Peterson to come up.
Thank you, Julie, and thanks everyone for being here today. So today, I call on our state and regional partners to help avoid the closure of shelters and homeless services in Multnomah County. Today, we are sharing with the public a deep funding gap and our need for regional collaboration to avoid devastating cuts to critical services and sustain our ongoing process to address homelessness in our community. Multnomah County's homeless services are facing a 25% reduction in the coming months due to a grim budget forecast of supportive housing service measure dollars and our Multnomah County General Fund, totaling $104 million. Recent economic forecasting shows Multnomah County will face a catastrophic budget gap in the upcoming fiscal year beginning July. Without help from our regional partners, this budget gap will mean cutting hundreds of planned shelter beds and eliminating outreach programs that move people from the street into shelter and housing. It will mean cutting rent assistance that directly prevents families from being evicted into homelessness and drastically reducing services for people with extreme mental health and substance use issues. These cuts will result in increased homelessness and suffering for our community. The goals that the city and the county have set for bringing people in from our streets, connecting them with shelter, housing, and services, and preventing people from becoming homeless in the first place are not only ambitious, they are necessary. This morning, I've sent letters to the state of Oregon and Metro requesting that they each provide more resources to prevent devastating cuts to life-saving and life-changing services. This is a regional forecast that will have implications across the metro area. And while I am here to tell you what the impacts will be on Multnomah County, I know there are financial implications for Washington and Clackamas counties as well. I also believe deep cuts in Multnomah County services will have serious impacts on residents in Washington and Clackamas counties. For that reason, I have asked our regional partners, Washington County and Clackamas County, to join us in conversation to address near-term and longer-term regional funding challenges so we can help maintain services together. Our region and our state cannot afford to see massive cuts just as we are sheltering, housing, and preventing more people than ever before from sleeping on our streets. Multnomah County has done what we said we were going to do by getting money out the door quickly in ways that are improving conditions in neighborhood all across the county we serve to the benefit of our entire region and state. Addressing homelessness benefits everyone. Stable housing improves community safety, economic vitality, and the well-being of everyone who calls Multnomah County home. Businesses, neighborhoods, and local economies thrive when homelessness is effectively managed and reduced. A well-funded response demonstrates regional leadership and commitment to addressing that which is without a doubt our most pressing challenge. While we are making progress, we know that significant work remains. Taxpayers want to see us pick up the pace of progress and continue working together. This will not be possible if we are forced to make the drastic cuts that are on the horizon. We cannot let that happen for the good of our region and state. With this great budget outlook, Multnomah County cannot do this alone. I do want to be clear that I am asking for existing resources that have already been raised from taxpayer dollars and do not request any new taxes to be raised. As we have with supportive housing service dollars, we must continue using a successful statewide and regional approach to this work. Multnomah County has 20% of the state's population, but serves more than 40% of the state's homeless population. Our services support the entire region. So so that we have the dollars that we need to do this work. Today, I ask the state to provide more resources to address homelessness statewide, including Multnomah County's looming shortfall. And to all of our partners, I have brought forward the budget caps for the city of Portland, knowing that their ability to sustain services also impacts our region. Multnomah County has allocated every dollar of SHS revenue it received last year and so far this year, directing funds quickly and efficiently to provide critical services. With these dollars, Multnomah County and the city of Portland now provide nearly 3,000 year-round shelter beds and 200 overnight shelter beds. On average, these beds are more than 90% occupied on any given night. Earlier this week, Multnomah County previewed our next shelter right here in this very spot. Oak Street Village, where we stand today, will provide up to 40 more people respite from sleeping on the street year-round, with a focus on people who would otherwise be sleeping in vehicles on the sides of the road. We're at this location today because this announcement is about the good that is being done and our community's expectation that we continue to make progress. We need Metro, the state, and our regional county partners to stand with us in the face of catastrophic cuts to the services that serve our most vulnerable. And now I will turn the podium over to the director of our Homeless Services Department, Dan Field.
Thank you, Chair, and thank you for your leadership. Long time no see for some of you who were here Wednesday. Thank you for coming back. And I promise these are not my talking points, just some backup materials. I just want to emphasize a couple of things that the Chair said. You know, when the voters passed the SHS measure in 2020, they were not only very generous, they were also very clear, and their message was simple: work together. We've given you the resources to address the challenges that we see in our community, and we want you to work across political lines, party lines, geographic lines, and ideological lines to do that. And Multnomah County has demonstrated great progress on that front. I'm really proud of the way we developed a very strong and productive relationship with the city of Portland, with the city of Gresham, with the other jurisdictions here. We're working closely with the state around the governor's initiatives, and we've worked very closely with other two county partners in Clackamas and Washington County. So today we're here really with just two simple messages. One, let's acknowledge what everybody already knows. Homelessness is a regional issue that doesn't know jurisdictional boundaries. The times call for us to be flexible and innovative in our thinking. And two, not only is Multnomah County the economic and social hub of our region, it's no surprise that it's where the challenges with homelessness are also most pronounced. And so today, I support the chair in calling for our state and regional resources to follow the need and follow the people and come to Multnomah County and help us continue to address the homeless issue with the urgency that we've demonstrated over the last few years. If we've shown anything, we've demonstrated that we can spend these dollars effectively with urgency and clarity around reducing unsheltered homelessness and preventing homelessness for others in our community. In 2024, last year, we spent all the dollars that were available to us through the SHS measure and then some. In the current fiscal year, we will do the same once more. And the results speak for themselves. We just released our Q2 SHS report very recently. With those data are available, you're able to see the progress we're making in rehousing people, in moving people through shelter, and also in preventing homelessness as well. One final point of emphasis before I turn it over to Jillian. We're proud of the job we have done to be good stewards of our resources over the last few years. Today, we're not here to ask for new tax dollars. We're here to ask for our other government partners to partner with us in being effective stewards of existing resources. And that means we need to work across regional, county, and state partnerships in unique and different ways. And I think the chair has laid out her initial ask for that, and we're excited to have those conversations in the days ahead. With that, I'll introduce the director of our homeless response system at Multnomah County, Jillian Shoney.
Okay, I'm just going to start by defining what that title means because lots of people confuse me and Dan. What that title means is that I play the role of intermediary between the city and the county and manage the spaces where we come together to set shared goals and to hold each other accountable as we make progress. So in other words, I work with the chair, the mayor, Director Field, many other elected officials and health and housing experts to work the plan. We are about 9 months into our renewed shared strategy, and we are making progress, as some of you have acknowledged in your media reports, and I appreciate that. The goals of the city and the county, as the chair said, the goals that we have set are not overly ambitious or unreasonable. They are necessary, and there is no other option than to achieve those goals. To do that, we need to maintain our momentum and fund the system that we have built in response to this emergency moment. And if we are able to do that, we can continue to move thousands of people off of our streets and into shelter and housing, as we have shown we can do. It's also true that the longer a person stays in homelessness, the deeper the scars and the harder it is for them to stay housed. So providing services now, doing what we need to do now, will prevent higher emergency costs later, like shelters, law enforcement interventions, and hospital visits, for example. So meeting this crisis with intention is what the homelessness response system is all about, and we must continue our commitment to stop the cycle and support people getting back on their feet with the right services. And I'll just leave it at that. Thank you.
So we're going to go ahead and take some questions. We're a little short, but I'll just start and I'll go around the room if you want to raise your hand and say who you are. And we'll start with Christina and then we'll go to Lillian.
Yeah, Christina with K2 News. Danfield said that you spent all the dollars available to you in 2024. The year-end report that you presented showed 176 million left over between supportive housing services and your homelessness department. Can you explain what you mean by nothing available?
Yeah, thank you, Christina, for being able to clarify. We really, for the last couple of years, we've had two pots of SHS money, the carryover money, which is what you're referring to, and the current year revenue, the money that Metro actually collects during that fiscal year and gives to the three counties. For last year and this year, we're spending every dollar of current year revenue, the collections for that year, and that's what those forecasts are that we've been referring to. We are still spending through the carryover that built up in those first couple of years, and that's the number that you're referring to. At the end of this year, we will have almost eliminated that carryover. We have it budgeted for next year. And that's why as we look into the next fiscal year, we're looking over a cliff because those carryover dollars are gone. We're down to just the real the revenue from that current year. And with those forecasts dropping, that's where our concern is.
So I guess I need some help understanding that cliff because you're saying you have a budget of 336 billion, but you have a carryover 176 million. So where's the deficit? It sounds like it's a carryover deficit, not an actual services deficit.
No, it's not a carryover deficit. So remember, our budget is made up of city general fund, county general fund, SHS revenues, the current year revenues, SHS carryover, and also state dollars. And there's some federal dollars mixed in there as well. So we have been carrying over those SHS dollars, as I said, from the first couple of years of the measure, but that ends next fiscal year.
So the budget is $136 total for 2025 or 2025 and 2026?
136 million is the current fiscal year revenue that Metro has said they will give us in SHS dollars. So just the dollars collected and distributed to the county in that year.
That's fiscal year 2025.
Yes.
Okay, so your budget is 420.
That the 420 number was what we call a current service level budget. That means if we took what we budgeted this year, put in a modest inflationary factor, carried that into next year, our target was 420 million. So that's sort of the very beginning starting point for the budgeting process. And we're coming in well short of that. When you add up the available resources, they come in well short of 420 million.
Sure. 317 is your revenue from the Metro tax.
That's our total available revenue from city, county, Metro tax.
And so you're short about from 420 to about
104 million.
But then you have 176 carryovers. Where is that coming?
Let me come over and follow up with you because I'm not sure what 176 carryover into next year is. That doesn't sound right to me.
From 2024, you had 63 left over according to your year end for 2023.
I'm gonna need to sit down and talk through that with you, Christina.
So we'll do-
Yeah.
Okay, awesome. Lillian, did you have a question?
Yeah, have you, Chair Peterson, have you received a response from either the counties that you sent letters to or state or metro about your request?
Yes, thank you. So the letters were sent today, although I did reach out and talk to the governor, legislative leaders, the metro president, and county leadership about where we were with this budget deficit. And then, as I said, we sent the letters with the concrete asks out today.
On the county leaders specifically, was there a specific like dollar amount that you're asking for from them?
No, as I said in my remarks, the difference in the budget forecast for the Metro SHS dollars impact Washington County and Clackamas County just as they impact Multnomah County, although because we have the largest population and receive the most money, we have the most impact to that. What I'm interested in, what I've asked for Clackamas and Washington counties is to engage in a conversation to talk about both the short-term needs and the long-term needs for those regional SHS dollars, to engage in a conversation about how we're going to use those going forward.
How is that gonna fill the gap? Sorry, I'm confused, but how is that gonna help fill the $104 million gap?
Yeah, so the major asks are from the state and from Metro, right? And then we also want to be engaging in conversation with the counties, but I don't want to make any assumptions about what they're able to do or not able to do, because I know, again, the change in.
To what purpose are you engaging in a conversation?
Yeah. Well, we're going to say, I think first of all, we have to, what I'm really interested in having the conversation where we're looking at, are the resources following the need in the way that we're currently allocating dollars? The SHS measure dollars are allocated according to population, but not necessarily the population of people experiencing homelessness. And that's kind of what we're seeing at the state level as well, in terms of the general population of Multnomah County and the people who are receiving homeless services in Multnomah County.
I'm gonna go there and then go ahead.
I kind of KBTV question for you, Chair. If you don't receive the requested amounts from the state or from the metro, when will the community start to see the impacts of these cuts?
Yeah, so the impacts of those cuts would come July 1st when we start our new fiscal year. So this is something that has really come up, and the reason why we're having you all here today is this is something as our Homeless Services Department is putting together their budget for the next fiscal year and recognizing the cumulative impacts of the decrease in the SHS funds, for instance, and the impact it has on both this year and next year. We recognize that this was the gap. So people will see that, starting in July 1st when those dollars aren't available. But this is something that is going to be public, when the departments are releasing their department submitted budgets, which will be available later today. I will put forward my recommended budget in April 24th, and then the board will consider and have to make budget decisions throughout April, May, when we vote on our budget in June. So these things will, although the impacts will happen in July 1st, we are going to be talking about them and hearing about the impacts from now until June.
Ariel, with that point, what about this sobering center that you all plan on purchasing for what is it, $7.2 million? This facility, what are the plans going forward with these projects?
Yeah, I appreciate that question. So we are committed to continuing the work that we've done with the Pathway Center on deflection. We are going to be opening in the next few months additional capacity at our Pathway Center for 13 sobering recliners and additional medical services, and we are moving forward with the permanent sobering facility. That is a different bucket of money than the Homeless Services Department's budget and dollars. We had a direct allocation for the sobering center and deflection services through the House Bill 4002 work and through the $25 million we received in the last legislative session. Those are the dollars we're relying on for that, and that's runs out of our health department.
And then just one other thing, still kind of going with the budget, but a little bit outside of the homeless services. We're hearing about potential layoffs across the country. Can you please comment on that?
Yeah, so we knew based on the revenue forecast that we had in late November that we were going to have a $21 million Multnomah County General Fund gap going into FY26. So since then, I've been working with the various departments and understanding what the budget impacts would be for them. They are submitting those budgets today, and in anticipation of what's proposed in that budget, there are conversations happening about the layoffs that may be happening. I do want to stress that we try to let our employees know early about those potential impacts. We try to let our partners and providers know early because there will be impacts for them and their employees as well. But the final budget decisions happen when the Board of County Commissioners passes the budget in June, and that's when we'll know what the total impact is.
How many employees got a notification that they might lose their jobs?
You know, I don't know that total number, unfortunately, but I do know that there are impacts across the departments.
I'm just making sure before we go to the second, we have just time for a couple more, so we'll go Christina and then Lily.
Yeah, what's the reason for the SHS fund coming under budget? Or under projected amount?
So I can give you some specific. So we received our updated revenue forecast from Metro in December, and I don't know exactly what goes into their revenue forecasting, but you know it's always helpful when those are as accurate possible. But forecasting is just that, forecasting. What we do know is that the difference for what was forecasted for that next fiscal year that begins in July was $21 million for Multnomah County. And we know that for this fiscal year, FY25, so the one that we've already budgeted for, the one that we're already, funding programs and services, that's about $21.5 million as well. And that's why there's that cumulative effect for next year, is that some of those carryover dollars that Dan was talking about that we were planning to spend in FY26 for programming, we're now having to use to fill the gap that Metro has let us know about this year. So we don't want to cut services that are currently happening that are, we know that would have a devastating impact on our community. So we are working to avoid that. But it does have that impact next year, and that's what I'm here to talk about.
Lily, final
We
question.
don't know why SHS came in lower than predicted, and there's no explanation on that.
I'll take a pass at that. So that's a question for Metro. I want to be respectful of their role. The tax is a high earner tax. It's on a relatively small layer of the Tri-County population, and as such, it's pretty volatile. And the forecasting, regardless of who does it, the forecasting has been really up and down. And so just a few years ago, we had unanticipated revenue. Some of you may remember, and that was as a result of the actual collections coming in much higher than anticipated. Now we're starting to see the reverse. In 2023, in the look-ahead forecast, Metro set a number, said Multnomah County, you're going to get $156 million. As they got closer to the date in December of last year, just a few months ago, they said, actually, that number is much lower. And now they've projected that out. I expect that will change again. And later in this year, that number could go up or down. And so the challenge is, how do you budget for programs like this project where you need to guarantee funding for multiple years? How do you do that in a really volatile revenue environment? That's the challenge we're facing. So nobody has done anything wrong here, but you have revenue projections going like this, and you're trying to create a steady set of growing programs to serve the need, and doing it on a very volatile revenue base.
Thanks, Dan.
Lily, final one?
Yeah.
And then, okay, we'll give you one more. Go ahead, Lily.
But like I said earlier, I'm Lillian Monta, Houston, Oregonian. It's sort of two questions, I'm sorry, but it goes to the same thing. So the first one is, of that $104 million that you're expecting to be a gap, which revenue drops, like in exact dollars, add up to $112 million? Because there were numbers given and then a summary of where the other drops are coming from, and it's just I'm unclear where those other parts are coming from. So could somebody go over that?
I have the same question.
Yeah. Yeah, so I will let me explain it as best as I can. And just I do want to, Dan, I appreciate you taking that question. To answer that in terms of like the decreases in that, in fall of 2024, we had we got notice from Metro that there was $50 million additional dollars that they were expecting us to spend that. Oh, so I'm sorry, it was the total of 50. It was $23 million more of SHS dollars that we were expected to spend that year. We spent that money and we built out our programs for that money. So what we're seeing for FY26 is that combination of a decrease in SHS dollars of $21 million. It is the carryover dollars, the absence of additional carryover dollars that we were planning to spend that next year that we're spending this year. It is also the fact that we programmed and spent those additional unanticipated funds of the $23 million that I talked about, for instance, and set those up, but those weren't ongoing resources, right? We did the best we could this year to continue many of those programs and services, including grants for providers, including day services, including expansions and partnerships like Bybee Lakes. But those dollars and that ongoing source of revenue, it does not continue into the next year, and that's part of that. So we'll get you those specific dollars because I know everybody is asking for that. So we'll get you that specific breakdown. But that is the combination of things that makes it up.
I think the issue, it might need like some workshopping here though, because we might get a spreadsheet that we're gonna have questions about, and we're all on deadline.
Yeah, totally get that. So after this, how about if we maybe break up into, we have a couple experts here we can spend a few tiny minutes with. We will get you answers, and we're gonna have one more question.
That was my question.
Okay,
Okay,
that's great. We
Wait,
really
wait, I have
appreciate.
one more question. So are there specific shelters that you are expecting to close or not open because of this cap?
So we're not sharing specific names of shelters at this time. I will say what we're looking at is shelters that were expected to close maybe in the next couple years. We're looking at having to close those earlier. And again, a lot of that information is going to be shared when the budget proposals are available later today.
That's great.
So thank you all for coming. This was huge. It is very complicated. I am going to ask anybody who has some of the specific questions to step over, and maybe we can start to answer some of those questions with some of the experts here and let the chair get back to her day. But really appreciate you being here. That's appreciated always. And press office at Malco will try to get back to you if you miss talking to us today. Thank you, everybody.